Hi, let's talk about headaches. Surgical headaches. Have you ever thought about why you may be having headache? Have you ever complained to somebody, I have a headache? Then, is it a surgical headache? You never can tell. Because many times, some headaches are not just innocent. Some headaches are not just, oh, I'm stressed, let me go and rest. Some headaches are not like those ones that they tell you, if symptoms does not resolve after 3 days, go and see your doctor. Some headaches, in fact, many headaches has surgical headaches. Many. Therefore, have you talked about a headache that occurs suddenly? Wow. Like a thunderclap. Sudden headache in your head. It's painful, it's hot, you want to pour water on it. That is a headache that may require both operative surgical or non-operative surgical intervention, especially from subarachnoid hemorrhage. Have you heard of headache that progress over a short time, 2-3 weeks, keep getting worse? It's another type of surgical headache. Can be coming from space of violation, like a tumor or an abscess or a chronic subdural hematoma. Have you also talked about headache that progress over years? Have you also talked about headache that appear just dull headaches? Many times, these headaches have surgical connotations and they may require a neurosurgeon's intervention. Do you know the problem? Many times people continue to take paracetamol or take other analgesics, and these drugs give them relief and then they think it's well. And they only get to come and meet us when they're already getting to have complications such as blindness, seizures, inability to walk, or loss of consciousness. Sometimes when they are almost about to die or even dead on arrival. Therefore, when you have a headache, all headaches are not innocent. All headaches are not from stress. Consider surgical headaches. See a neurosurgeon. Please send this message to your friends. Send this video to your friends, your loved ones. Share it wide to save lives. Because many headaches can be solved if they come early enough to the neurosurgeon. Please. Thank you so much. I am neurosurgeon Dr. Mark O, and I'm here to give you a guide to be better health status. Thank you and God bless you. Please like, subscribe, share, and comment. And follow. Please. Have you started following? Follow now. Tap that button.